In the 3/4 of a century since WHO was founded, the world has seen major improvements in health. Life expectancy globally has increased from 46 to 73 years, with the biggest gains in the poorest countries. 42 countries have eliminated malaria. We have pushed back the epidemics of HIV and TB, driven polio and guinea worm to the brink of eradication, and expanded access to curative treatment for hepatitis C. In the past 20 years alone, maternal mortality has fallen by a third, and child mortality has halved. In just the past 5 years, new vaccines for Ebola and malaria have been approved and are now saving lives. The challenges of today are very different from those we faced in 1948. Non-communicable diseases now account for 70% of all deaths globally. Tobacco still kills 8.7 million people every year. Obesity rates have skyrocketed. The COVID-19 pandemic highlighted the huge burden of mental health disorders and the weaknesses of health services. Antimicrobial resistance threatens to unwind a century of medical progress. Vast disparities persist in access to health services between and within countries and communities. And the existential threat of climate change is jeopardizing the very habitability of our planet. WHO also faces its own institutional challenges. Over the past 20 years, the world expectations of WHO have grown enormously, but our resources have not. These are daunting and complex challenges. We will not solve them at the World Health Assembly, and we may not solve them in our lifetimes. But the destination is sure and is closer now than when our forebears began in 1948. The highest possible level of health for all people.